Hi, everyone. I'm Perla Piekutowski, Director of Growth and Engagement here at Fairfax Surrogacy. And I'm thrilled to be joined today by Dr. Susanna Park from San Diego Fertility Center. Hello, Dr. Park. How are you doing?
I'm doing well. And Perla, it's great to see you again.
It is great to see you too. Thank you so much for taking the time to talk to us today. Um, Dr. Park, to start, I would love for the audience to learn a little bit more about who you are and what area you specialize in.
Sure. So I'm actually, well, a little bit about me. I was actually born in Korea, raised in Argentina till I was 6. And then my family moved to New York. So I've been a New Yorker, gosh, I lived there for over 40 years. And then about 10 years ago, my family moved, my immediate family moved to California. So I'm really not a Californian. I'm actually a New Yorker at heart. So
I-
I've been a fertility doctor now for about 20 years. So it's been a while. And taking care of all types of infertility patients, but really my specialty has really ended up being focused on people who need what we call third party. Third party would be somebody that either needs an egg source, like an egg donor, or a carrier, like a surrogate. And that could be for a person who's single, male single or female single. It could be for a male-male couple, female-female couple, or a male-female couple. So all types of families.
Well, thank you so much for sharing a little bit more about yourself, Dr. Park. And I did not know you had lived in Argentina. That's new.
Yeah. So Spanish was actually my first language. So when I moved to New York, I was put in a bilingual Spanish class because I didn't know any English. Isn't that
Well,
funny?
that's perfect. That's perfect. We work with so many intended parents who are
Uh-huh.
bilingual as well and surrogates. So
Yeah.
that is good to know. That is good to
Yeah.
know. So today, Dr. Park, so we're going to be taking about 30 minutes of your time, if you don't mind, and we're going to be talking about the very important topic, which is the surrogate requirements and expectations for a surrogacy
Mhm.
journey. So I wanted to start, if you don't mind sharing with our audience, with what qualifications San Diego Fertility Center considers when selecting surrogates, and what are some of the most common disqualifying factors as well.
Yep, great questions. Okay, so just to start, intended parents and surrogates need to know that your surrogate cannot be your egg donor as well. That's very important, right? So many times I have patients that say to me, oh, I have a great friend and she wants to help us out and she'll give us the eggs and she'll carry for us. And that's absolutely no. And the reason for that is we don't want the surrogate to be too tied into the pregnancy. And so if it's her egg source, we feel that there is a higher risk that she may feel this tie to the pregnancy, which is they are two separate things. She should be the carrier, but not the biological egg source. Okay, so there are national criteria, minimum criteria to be a surrogate. And this criteria was put forth by the American Society of Reproductive Medicine. We call them ASRM.
Mhm.
That is our national organization that puts forth these guidelines. And they put forth the minimum guidelines, and then it is up to the clinic to add on top of that. So at the bare minimum, there is an age criteria that a woman can be a surrogate up to the age of 45. Personally, I don't know. Like if I was an intended parent and my surrogate was 44, and that's not to say it's bad or wrong, it would make me a little nervous, right? Because as women get in their 40s, there's a higher risk of diabetes and high blood pressure. So it would make me a bit nervous. Now, if it was a family member or a friend, my gosh, and she was 43, by all means, I would welcome that because that's really a gift she's giving you. But if it's somebody that you don't know and you're paying them, me personally, to me, 44, 45 just seems a bit on the older age. But again, that's an individual decision. So if an intended parent said, I love this surrogate, was presented to me by Fairfax and she's 44 and she's the one, I will fully support it if that's what the intended parents want. Okay, so age criteria. Then pregnancies. So surrogate should have been pregnant 5 or less times. Okay, that's the number of deliveries. So if she miscarried, that doesn't count. So 5 or less deliveries. And of those deliveries, she should have had at least one pretty normal, uncomplicated pregnancy. And we'll go over other pregnancy complications in a second. Then mode of delivery, 3 or less C-sections. Okay. So again, people have different opinions on C-sections, and some people feel that I don't want to surrogate with any C-sections. Okay, that's a personal preference. Other people feel very comfortable with surrogates who've had multiple C-sections. And the reason why 3 is chosen as the limit is because the more C-sections a woman has, the greater the chance the uterus will rupture and during pregnancy. And then that's a surgical emergency. Okay. And then stable family. And that's, I know it's a very general term, but right, a lot of the agencies will delve really deep into their living situation, who their support people is, to make sure that they have the resources they need to help them through the pregnancy and help them with their own kids so that the pregnancy is very successful. And that's really like the basic criteria. On top of that, we do add a weight criteria, a body mass index. And it's changed over the years. It used to be, so BMI of 25 or higher is called overweight. BMI of 30 or higher is obese, and 40 or higher is morbidly obese. So our BMI criteria used to be 30. But the truth was we were really having a hard time finding surrogates meeting that criteria. And so our BMI index now, the upper limit is 32. Okay, but I really encourage if all the surrogates out there listening, just really, everybody's built differently, right? And not everybody is like thin boned and petite, but really do your best to really get yourself to as healthy weight as possible. And it's less about weight, even though I know we measure weight, but it's more about healthy lifestyle, right? Being aware of what you're eating, how much you're eating, exercising regularly, so you can have the best pregnancy possible.
Is that by time of embryo transfer or by time of reviewing the medical records?
Ideally, it would be as soon as possible. But for example, when I meet surrogates and their body mass index, when they come in, it's like 31.9.
Yes,
I tell them, listen, you met the criteria, but it sure would be great if you could, first of all, do not gain more weight. But two, if you could try to lose some weight, that would really be helpful. And can I tell you that 99% of surrogates to whom I say this tell me, oh, no, I already know this is heavier than I normally am, and I'm already working on it.
Yes.
Right. So they already know, right? So, okay.
Yeah, we see that often too. That's why I asked.
And another thing is that there are people who use egg donors to create their embryos. And then they're now pivoting to look for a surrogate. And many times they get the criteria confused. So your egg donor is the genetics of the child, right? So of course it's important to do genetic testing. The carrier, the surrogate, you're not using her genetics. So her genetics is not as important, right? What's more important is her ability to carry. So a common question I get asked is, oh my goodness, my surrogate, they presented me with surrogate, she's 39, like she's so old. And I tell them, oh, well, wait a minute. She's not your egg donor, right? We want a young egg donor. But for a surrogate, 39 is fantastic, right? She's great. And she's been pregnant a number of times. She's mature, right? It's okay. So the criteria are very different between an egg donor and a surrogate.
Thank you, Dr. Park. That's really, really helpful. Now, this is part of the considerations when you're evaluating somebody before they come into the clinic in person. What about when they get to the clinic in person? What type of tests do you usually run in the surrogates?
Good question. Okay, so before surrogate comes in, right? So when surrogates, when you ladies fill out your application, you write your history. And Many times you are a lay person. So sometimes when things happen in the hospital, you don't fully understand or remember what happened. So our job for the intended parents is to get all those hospital records, which takes weeks, by the way. Okay. And it's so hard to wait, but we really want hospital records and office records. And we go through every piece of paper and we look for these complications. And it's not uncommon for a surrogate to say, hey, yeah, everything went fine. And then we look through the records and we see, oh, wait a minute, there was an issue with this and an issue with that. Because remember, these were pregnancies long time ago, and many times the surrogates just don't remember. Okay, so many times when we look at these records, we will reject a surrogate even before she comes in, because just based on the records alone, there are just too many risk factors. Okay, but if she passes the medical record review when she comes to our center, and yes, if your surrogate lives in, let's say, New Jersey, she must still fly here for the in-person evaluation. It takes about 3 hours, and there are a couple things happen. Number one, different people will speak with the surrogate because we all want to get a sense of what she's like. And of course, if the surrogate comes with a friend or partner, of course, that person's welcome to come as well. Two, the surrogate gets a full physical examination, and that includes an evaluation of the uterus. And the evaluation of the uterus is not only to see how thick the uterus is, but also to put a water in the uterus, make sure that the inside of the uterus has nothing growing inside. There are no polyps, there are no fibers, there's no scar tissue. And then blood work is done for different infectious diseases, different hormones. There is also urine test. There's also a drug screen that will happen, and that also includes smoking screen. Okay, so it's really important that surrogates truly are committed to the process, keep themselves as healthy as possible. They're not smoking, they're not doing drugs, because this will get tested throughout the process. Okay. And then, sorry, go ahead.
No, Dr. Park, I had a follow-up question, but I was going to backtrack a little bit. You mentioned that before coming to the fertility clinic, you make sure that the medical records are reviewed, and then in certain situations, you're going to reject somebody before they even come. Can a woman who wants to be a surrogate be considered if she doesn't have medical records available because she gave birth so long ago?
Ah, good point. And Perla, that is a common problem, right? Because hospitals only keep records for so long and then the records get purged. Yes. So in cases like that, we tell the intended parents, look, it is impossible to get the records, right? Or sometimes they gave birth at a different country and then they immigrated to the United States, and there's just no way we're going to get those records. Yep. So we tell the intended parents, look, we just can't get the records. So we're going to have to just base our decision on her in-person evaluation. But that means intended parents have to sign a form we have, which basically states that due to the lack of records, we were unable to assess risk, and that all the risk is really going to be based on the in-person evaluation. Yeah, it's actually not that uncommon, believe it or not.
Yeah, we see this all the time. And would the testing that you do in person be any different for those women who have no records, or would it be the same?
Oh, good question. Nope, it's the same tests.
Okay,
Mhm.
and are those tests painful? You were talking about that. I'm just
I
curious for
know.
our surrogates.
I know. So, I've had this water test of the uterus. I mean, it was like 3 minutes. It was pretty fast. It's
Mhm,
generally not, especially if she's had a vaginal delivery, it's like so easy.
mhm,
I think the only times it's painful is if she's had all C-sections. Sometimes that C-section scar can change the angle of the uterus, and then the catheters don't slide in. You kind of have to do this, do that, change the angle, and then it slides in, and then it can become uncomfortable. But that's actually not that common in surrogates. And if that is the case, it's good that we know, because then for the actual transfer, it's kind of going to be the same experience. So then we know, okay, this transfer is going to be a little bit more challenging. Maybe we offer her Valium, which we normally don't do for transfer because it's usually super easy. Maybe we offer her Valium. And in super, super, super tough cases, and this usually is if you're using a family member or friend, we can even put them to sleep for a transfer if it's really uncomfortable. But we really try not to do that because if normally the transfer is done in a regular room so everybody could see. But if we're doing it in an operating room, the family members are not allowed in the room.
Yeah, I don't think I've heard of any of our surrogates having to
No,
go through that.
yeah, it's
Yeah,
very rare. Mhm.
yeah, yeah. Well, go ahead.
The other thing I wanted to mention was when the surrogate comes for evaluation,
Hmm.
um, the partner doesn't have to come, but the partner also will need blood testing for infectious diseases. So if the partner comes, great, we'll draw the partner's test as well. If the partner does not come, we actually can send a mobile unit out to wherever the partner lives to get the test done. So the surrogate can travel by herself. She doesn't have to travel with a bunch of other people,
That is
which
great because it's
saves
already a huge
costs.
commitment.
Yeah, yeah.
Yeah, yeah. And talking about commitment, Dr. Park, how do you ensure that the surrogates understand the commitment and the expectations on the medical side?
Oh, wow. Yes. So this is where, right, we need to partner with a good agency because a surrogate will be educated on two fronts, right? One is the surrogacy agency, and the surrogate has the coordinator who will with the surrogate step by step to make sure all questions are answered, the surrogate is compliant, etc. On the medical side, we do the same thing. So when she comes here for in-person evaluation, we go over all the medical things she will be doing because her medicines, and they're different protocols, but a lot of the protocols are a combination of tablets by mouth, big progesterone shots in the butt. Sometimes estrogen shots are in the butt. Estrogen can be in the form of patches. Estrogen can be in the form of vaginal capsules. Like there are all these different types of routes of administration of these medications. So when she comes into our office, the medical team makes sure we go over the protocol, make sure that she understands how to do the medications, how to do the injections, etc. We give her teaching forms. It's like this folder with all this teaching stuff, one of which is a diagram of here's where you inject, etc. So, and that teaching continues even after she leaves with the nurse coordinator when the nurse coordinator orders a prescription to make sure, do you have any questions? Do you know how to do this? And then as she's taking the medication through blood work, we can see if she's doing it correctly and or if she's being compliant or not.
And I have to say, Dr. Park, I have been impressed by your entire team because they are so detailed in all of the communications. And I think it makes it so much easier, not only for the surrogate, but also for us as an agency, because they get all the information timely and very step by step. So it is always really nice to work with a clinic that, guide everyone in what's going on. So you mentioning that it's very important because of the way that San Diego Fertility has the protocol set up and providing support for the surrogates as well when they have to get into the cycle.
Yeah. Oh, thank you. Thank you. Yeah, we really try to, communication is big in our practice, right? Because when you have these third party people involved, you've got to make sure everybody's on the same page. And so we do really have our protocols in place to streamline. But then, of course, right, things happen and that you cannot anticipate. And so all intended parents and surrogates, right, you see the email chains going, and you can always email the physician, myself, the coordinator, absolutely, to try to make sure mistakes don't happen.
Yeah, yeah. Well, thank you, thank you. Another question that comes to mind, Dr. Park, is what advice, what guidance do you give the intended parents from the medical standpoint when it comes to choosing their surrogate and what
Yeah.
considerations they need to keep in mind?
You know, I've been doing this so long, and it's so interesting to watch people's journey. And well, first of all, for some people, depends on your history, the decision to go to surrogacy was a very difficult decision for some people, especially the ones trying to use their own uterus. So that was a big step forward. For some people, that was their only way from the beginning to have a family. So the decision to choose a surrogate, it's big, but it's the carrier that will deliver your child. In the beginning, and understandably, everybody looks for perfection, right? The problem is there is no perfect surrogate. Every surrogate, every woman has something in her pregnancy history that will make you think, oh, okay, is this okay or not? So, for example, let's say a woman had, in one of the pregnancies, she had mild blood pressure problems. Okay, we don't reject her for that, right? It's okay, it was mild. But in the next pregnancies, if it's getting progressively worse and worse, then I would say, okay, well, this is not good because it's getting worse and worse. But if the next pregnancy it was mild again, or maybe she didn't have it, then it's okay. But there's no surrogate who's had zero medical issues in pregnancy. That just doesn't exist. Okay, so medically speaking, it is our responsibility. We will make sure that medically there are no major problems. Now, sometimes I do have surrogates where it's a bit of a gray zone. In cases like that, I will speak with the intended parent and tell them these are the facts. This is what's happening. How do you feel? Do you feel that yes, she's worth moving forward with, or do you feel too nervous and say, this just we don't feel okay about this, and then we'll just move on and tell the agency to present you with a new surrogate. Obviously, if it's outwardly bad, we don't even have a conversation. I just say no from the beginning. Okay. So that's the medical part. But then there's really also the social part, right? And I tell intended parents, I know it's hard through a Zoom because mostly you meet them by Zoom. I know it's just hard to get a sense of what the person is like because, of course, they put their best foot forward during Zoom, right? But try to speak with them and get a sense of who they are and what they're doing, what their lifestyle is like. And I tell intended parents and be honest with what's important to you. So, for example, I have some intended parents who say, I don't really care what she eats. She obviously has 3 kids. She's done this well. They're all healthy. I trust her. And I have other intended parents who are very strict about the type of foods she eats, the lifestyle she leads, etc. And I tell intended parents, you need to share that with her during your Zoom call because you need to be honest. There's no point not saying it. And then later you mention it and you realize, oh, wait, she's drinking Coca-Cola and we're not big fans of soda. That conversation needs to be had at the beginning. And you're not judging, you're just sharing your values that are important to you. And you need a surrogate who will either have the same values or, if not, willing to change out of respect for your values, because this is a team effort. And I know sometimes it's hard for intended parents to have that conversation, and that's where the agencies come in, right? So I tell the parents, if you don't feel comfortable saying that, please tell the agency and let them have the conversation with the surrogate, but you both need to be on the same page.
Thank you so much. That is so helpful. You mentioned a little bit earlier about the differences between choosing an egg donor, who the egg donor is, and who the surrogate is. Is there anything else that may differ when it comes to lifestyle choices or when it comes to family history between the egg donor when you're choosing your egg donor and you're choosing your surrogate?
Yep. So sometimes in the egg donor's history, you may notice, okay, um, maybe the donor's brother has Down syndrome or some kind of DNA mutation, or somebody in the family does. For the surrogate, that's not relevant because, again, you're not using the surrogate's genetic material. Okay. For example, let's say there's a family history of alcoholism in the egg donor. And if, let's say, the sperm source has a family history of alcoholism, probably not great to combine the egg donor and the sperm source both with alcoholism. But that's, again, a very personal decision. Whereas with the surrogate, she has an uncle with alcoholism. It's kind of irrelevant because, again, you're not using her genetic material, but of course, you should make sure that she herself leads a healthy lifestyle. So when choosing a surrogate, it's less about genetics. It's really more about her personal health, her social network, so she does have the support she needs, her lifestyle choices with regard to how she eats, what does she do for work? How stressed is she at work? Things like that is more relevant as opposed to her genetic material.
Got it. Thank you so much. Dr. Park, it's such a pleasure to talk to you always. This has a wealth of information, and I'm sure it's going to be so helpful to anybody considering surrogacy as an option. Is there anything else that you would like to share with our audience?
Yep. Many times I have intended parents who try to find surrogates through Facebook and online.
Mhm,
And it's not that I'm opposed to it, but I get very nervous, right? Because what happens is a lot of these surrogates who are online on Facebook, and I'm not saying all of them, I'm just saying some.
mhm,
There's one has to wonder, okay, why is the surrogate going through this without an agency? And it may be because the surrogate, she's done this so many times, she knows how to do this, and that's fantastic. But sometimes these are surrogates who are not accepted by an agency for medical reasons or social reasons, right? Maybe the agency just felt like her personality is too intense and this is not for her. So just beware when you find a surrogate through an online setting and it's not through an agency. Two, there are many, many circumstances where you rely on the agency during the pregnancy to help communicate with the surrogate or help you know the topic, but you don't know how to go about discussing with the surrogate. And that's where the agency says, hey, how about here's a way to communicate that to the surrogate. So the agency actually plays a very important role in the pregnancy. And Pearl and I are fully aware of the rising cost of surrogacy, right? We have this discussion.
mhm.
We're working on Plan B. Like we are fully aware of it, but understand that the yes, there's an agency fee, but the money that's paid to it, there is a reason why you work with an agency. If it's just you and the surrogate, especially if she's done this before, and for the intended parents, this is your first time, there is room for a lot of manipulation. And again, most surrogates are not like that, but I've seen it happen and it exists. So just be careful that there is a reason why most of our surrogacy cycles are through agencies, because there is that safety net to make sure that you get from point A to point Z without having, without being manipulated, without having a lot of money taken from you.
And I'm glad you mentioned that, Dr. Park, because one of the things that I don't think most people realize is the amount of women who want to help but are not able to help for one or another reason, whether it was something that we found in the psychological screening, in the medical records. They may not even be aware that that's a problem, right? You mentioned that earlier. So that is what the agency is doing. We first, we get applicants every single day, but only about 10% of those applicants would fully pass our vetting process. And that is, we do criminal background checks, we do psychological interview, lab testing. And then before we even send our surrogates to medical screening in person, we ask the fertility clinic the intended parents are working with to review the medical records and the full file to let us know, yes, I think this is a good candidate, we can move forward, or no, this is not something that we would approve. So it is so important. You only know what you know. And there's so many things that we do behind the scenes to protect the intended parents, but also the surrogates, because we don't want to put anybody at risk.
Yep, absolutely, absolutely. Yeah, there's some surrogates who really have good hearts, good intention,
Mhm.
but when we look at the records, I mean, I've seen surrogates who've almost died delivering the past pregnancy, and it's just we tell her like, you can't be doing this again. Like, I know you want to, but for your safety, for your children,
Yeah,
you can't be doing this again. Yeah.
yeah, yeah.
Uh,
So we narrow it down for you. We narrow down the choices between the agency and the fertility clinic to make sure that you have someone who is going to have no risk or very little risk doing this for you.
Yep,
So,
absolutely. Yeah.
Dr. Park, always a pleasure to talk to you. And thank you so much for your time and for sharing your expertise. And I look forward to reconnecting pretty soon in person.
Absolutely. Good to see you again, Perla. Great talking to you.
Great talking to you too. You have a great day.
You too. Bye.
Bye.